Okay. Okay, everyone. Thank you again for joining. My name is Erin Bauman. I'm a senior program manager here at Red Door Community. So excited to have our guest who'll provide to you very valuable information that I think all of us really need. It's, Medicare can be very confusing. It can be very frustrating. So it's really valuable to have a professional kind of go through it and normalize that frustration and give you some really good resources that you can kind of connect with offline. Our speaker is Dr. Gil Kunken. He served for 17 years as the Deputy Regional Administrator for the Federal Centers for Medicare and Medicaid Services New York Regional Office, which has oversight responsibility for the Medicare and Medicaid programs serving New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. One of his responsibilities was to oversee outreach and educational staff that presented Medicare information to new and current Medicare beneficiaries. He served for 30 years as a commissioned officer, in the U.S. Public Health Service. He spent 26 of those years detailed to the U.S. Coast Guard. In the Coast Guard, he was a senior healthcare executive, including a chief dental officer, chief of quality assurance, chief of health and safety, environmental health for the Coast Guard's Atlantic area, and chief of operational medicine. He also led a U.S. Senate-directed healthcare task force to help integrate the Coast Guard into the Department of Defense's TRICARE military healthcare program. Dr. Kunken received his Bachelor of Science degree and his Doctor of Dental Medicine degree from Temple University and his Master in Public Health degree from Columbia University. He is a fellow of the American and International College of Dentists and has held several dental school faculty appointments. Dr. Kunken is currently a Medicare consultant for the New York City Department of Aging, and he is an insurance counselor for the the New Jersey State Health Insurance Assistant Program. I am so thrilled for him to come back and provide this to all of you, and I will let you take it away.
Well, thanks so much, Erin. And it's always fun hearing one's eulogy when they're still alive. The slide says, good afternoon, everybody. The slide says Medicare 2023. I'm going to try and provide whatever 2024 information we have at this present time. It's still a little early. We'll probably be getting the numbers about the premiums and the deductible in the next few weeks from Medicare. But as Erin mentioned, I am a consultant for the New York City's Department for the Aging, otherwise known as Aging New York City. And I work for the HICAP program, HIICAP, stands for Health Insurance Information Counseling and Assistance Program. And we have trained volunteer counselors that can help you understand your Medicare benefits. So the key thing for you to remember is you are not alone. It can be confusing, it can be complex, but our counselors are at the ready. The phone number to reach them is 212-244-6469. That's 212-244-6469. You can also remember it by 212-AGING, AGING, NYC, and they will counsel you over the phone, or you can make an appointment and come to our office, which is at 2 Lafayette Street in Lower Manhattan. I think I am going to stop my video so that you're not distracted by the beach, and we'll go on with the presentation. So these are the topics I want to cover today with you. We'll introduce you to Medicare if you're new to it, and it'll be a refresher for you if you're already on it. We're going to talk about how to enroll, what the cost sharing is with Original Medicare, because Original Medicare is not free. There are significant out-of-pocket costs. One of the ways that people deal with these out-of-pocket costs is by purchasing a Medigap, a supplemental plan to pick up the Part A and Part B out-of-pocket costs that Original Medicare doesn't cover. Some people are fortunate enough to have retiree health benefits that function like a supplement. Some people may qualify for assistance programs like Medicaid or the Medicare Savings Program, which can also function as a full supplement. We'll then talk about the other way to get Medicare, which is the plans that you see advertised a lot on television. They're known as Medicare Advantage plans. Regardless of how you get your Medicare, you're entitled to prescription drug coverage. That's referred to as Part D. And at the end of the presentation, I'll review some income-based programs to assist with costs for those who qualify. So let's start with what Medicare is. Medicare is a federal program. It's administered by CMS, which is the Centers for Medicare and Medicaid Services. They have 10 regional offices around the country. One of them is in downtown New York City. And let's talk a little bit about who's eligible for Medicare. Age 65 is the big one. People who are declared disabled by the Social Security Administration, which means you can be eligible for Medicare if you are disabled at any age. People who are on kidney dialysis, known as end-stage renal disease, qualify for Medicare coverage, as well as people with ALS or Lou Gehrig's disease. Now, anybody who is already getting Social Security benefits before age 65 is automatically enrolled by the Social Security Administration into Medicare Parts A and Part B. And it used to be that most people were automatically enrolled in Medicare because most people were taking their Social Security benefit by age 65 because that was the full retirement age to get 100% of the benefit that you earned from paying into the Social Security system for at least 40 quarters while you worked or while your spouse worked. However, as most, if not all of you know, the full retirement age for Social Security has been slowly creeping upwards. And now it's working its way up to age 67, depending upon when you were born. And the result is that more and more people are delaying starting Social Security, either delaying it until they can get their full 100% benefit at age 66 or 66 and a half or 67. Some people are further delaying Social Security until age 70 when they can start collecting their maximum Social Security benefit. So the result of that is people have to take affirmative steps to enroll in Medicare to avoid being hit with any penalties for late enrollment in Part B, for late enrollment in Part D, and also, just as importantly, to avoid any gaps in coverage if health insurance that they have from an employer stops when they turn 65. Now, throughout this presentation, we're going to be talking about the only two ways to get Medicare because there are only two ways to get Medicare. Original Medicare, where you get your benefits through a traditional program that's administered by the federal government, and that's when you show your red, white, and blue Medicare card when you go to the doctor's office. Or the other way to get Medicare, which are Medicare Advantage plans. These are private plans that are administered by insurance companies. They give you all of the basic Medicare benefits, but the insurance company is the one that you will deal with when you have a Medicare Advantage plan. And interestingly enough, right now in the United States, we have roughly a 50-50 mix between people on original Medicare and people in Medicare Advantage plans. So we'll talk about both the ways to get Medicare throughout this presentation. So this is another graphic to show you how this plays out between the two choices. With original Medicare, you have your Part A hospital insurance coverage, your outpatient coverage under Part B, and you're entitled to prescription drug coverage. All three of these components are separate, and you'll typically pay a separate premium for your Part D coverage. With Medicare Advantage plans, everything is bundled together in one plan sold by that particular company. They'll either be HMOs or PPOs. We'll discuss the differences a little later on. And Medicare Advantage plans by law must give you all the same basic benefits as original Medicare, and they may give you some additional benefits as well, but there are some important limitations and restrictions which we'll cover. Now, with original Medicare, as I mentioned a few moments ago, there are significant out-of-pocket costs, and most people choose to have some type of supplemental insurance. It's referred to as Medigap because it fills in the gaps that Medicare doesn't cover, or if they're fortunate enough, they have a retiree group health plan. With Medicare Advantage plans, there is a maximum annual out-of-pocket amount that you're liable for, and therefore you're not allowed to have a supplemental insurance plan with a Medicare Advantage plan. And all of this information is going to be repeated throughout the presentation. So I know I may be going a little bit fast, but we have a lot of information to cover in the hour, and I do want to leave a lot of time for questions. So to continue with the choices in Medicare, with original Medicare, you'll have more provider choice and more complete coverage. Why? Because you can go to any doctor in the United States, in Puerto Rico, in the U.S. Virgin Islands, or in the Pacific Territories that accepts Medicare. There are no networks with original Medicare. However, because there are out-of-pocket costs associated with hospitalizations, as well as with outpatient care, most people will typically purchase a separate supplemental plan if they don't have retiree insurance, So it adds on to the cost that they pay for the benefit of being able to go to any doctor that they want to, because you'll be paying these costs every month, whether you use these services or not. Now, the other way to get Medicare through private plans, Medicare Advantage plans, you have some restrictions because there are provider networks to deal with. And typically, to get the most benefits from your plan, you must use the doctors that are in the network. And there's also a pre-approval process for higher cost procedures like MRIs and CT scans and surgery and various forms of therapy and nursing home admissions, etc., where the company selling the plan reviews the doctor's notes and recommendations before they give approval for you to go ahead. With Medicare Advantage plans, many of them have no additional premium. And since, as I said a moment ago, you're not allowed to have a supplemental plan, with Medicare Advantage plans, if you're relatively healthy and only go to the doctor for a few visits a year, all you'll pay is the co-pays for those visits, and you won't be paying any other premiums because typically your drug coverage, which under original Medicare you would have to pay a premium for, is covered under Medicare Advantage plans. And with Medicare Advantage plans, you may also get additional benefits like dental and vision and hearing, and I'll cover those a little later on as well. So that, again, the two different ways to get Medicare. Original Medicare and Medicare Advantage. So now let's talk about how you enroll if you're new to Medicare. Again, if you're getting Social Security prior to age 65, your enrollment in Parts A and B is automatic. Now, when you turn 65, in the year that you turn 65, you need to be aware that you have a 7-month window to apply for Medicare Part B. It starts 3 months before your 65th birthday, includes the month of your 65th birthday and the 3 months after. So if you enroll in any of the 3 months prior to your 65th birthday month, your coverage will begin the first of the month of your 65th birthday. If you enroll in the month you turn 65, your coverage will begin the first of the following month. And also, if you enroll in any of the 3 months after 65, your coverage will also start the first of the following month. What's our advice? Be the early bird. The early bird gets the worm. You know you're going to be turning 65. Mark out those 3 months prior in your calendar. Call the Social Security Administration and enroll in Medicare so that you'll have seamless coverage when you turn 65. Now, some people continue to work beyond age 65, and they work for a large employer, which we typically define as one with 20 or more employees, and they get their health insurance through their employment or through the employment of a spouse. In this situation, it cannot be from a domestic partner's health insurance. It must be through a spouse. If you're covered under active employment from a large employer, you are allowed to continue with that insurance and not enroll in Medicare Part B, and you will not be subject to a late enrollment penalty for Part B because you're given what is known as a special enrollment period that lasts up until 8 months after you've retired. And in any of those 8 months or in any of the months prior to retirement, you can enroll in Medicare using a special enrollment period. There are 2 forms that need to be filled out. One is provided by the employer, where the employer certifies that you had active health insurance. The other you fill out where you tell Medicare when you want your coverage to start. That's known as the special enrollment period for people who continue to work and to work for an employer of 20 or more employees that offers active health insurance. And then finally, some people forget about the initial enrollment period. They don't qualify for special enrollment period. There's a catch-up every year known as the general enrollment period. It lasts from January 1st to March 31st of each year, and your coverage begins the first of the following month. And this is a big change because in previous years, it used to be that if you enrolled in January, February, or March, you had to wait until July 1st for your coverage to begin. And that's where some people got caught by getting hit with the late enrollment penalty for Part B, which adds a 10% penalty to your premium going forward forever. So that's enrollment. That's the differences between the 2 forms of Medicare. I'm just going to pause right now and ask if anybody has any questions before I go further. And you can unmute or you can put questions in the chat. If you put questions in the chat, I'd ask that you select everyone so that we can all see what the question is. So I see there's a hand raised. Valerie, can you unmute to speak?
Hi, yeah, thank you so much. I have a question. You mentioned the offices in New York that you can sit down with people that are, have expertise in this. If indeed one does have insurance and is working, how would one tease out all the details comparing what might be better? Would it be better to proceed on the corporate plan or the organization? Comparing those two plans during that enrollment, would that be seeking the counsel of the folks you were talking about earlier?
Yes, the answer is yes. You would need to have all your information handy with you, and they would need to know whether or not your employer allows you to continue after 65 and function as primary, or whether or not you would need to enroll in Medicare, and then your employer coverage might sometimes become secondary to that. So everybody's got their own specific situation, and that's why we recommend making an appointment with a counselor. Right.
Thank you.
Sure. So when you enroll in Medicare, this is the card you'll get. And if you've been paying attention over the last few years, your Social Security number is no longer on the card. You have your own unique alphanumeric number now. And the card tells you when your Part A hospital coverage began and when your Part B coverage began. Now, why do they separate out these two? Well, because, for example, when somebody continues to work, they may delay enrollment in Part B, but because Part A is premium free for about 99% of the people who've paid into Social Security during their work history, they may start their Part A right at age 65. So going forward, here's the definitions of some of the terms you need to know. Premium, deductible, coinsurance, and copayment. So the premium is a monthly amount that you pay to have Medicare, or to have a Medicare Advantage if they have a premium, or to have what is known as a standalone Part D prescription drug plan. The deductible is the amount you have to pay before your healthcare services and your insurance begins to pay. Your coinsurance represents a percentage that you're responsible for. So with Part B outpatient care, once you meet your deductible, you're typically responsible for 20%, and Medicare pays the other 80%. And the copayment is a fixed payment that you pay for each medical service, and you'll typically see copayments with Medicare Advantage plans each time you go to the doctor, and you'll see copayments with the Part D prescription drug plan. So that's the terminology that we need to be familiar with. So what does original Medicare cost? Well, Part A is premium free if you or your spouse worked 40 quarters and paid into Social Security during your lifetime. And again, that covers about 99% of the population. For those people who don't have that work history, there is a Part A premium structure. The Part B premium is currently $164.90 a month for most people, about 93% of the population. Those who earn more will pay more. And most people will pay 20% coinsurance for most services for original Medicare outpatient care. Now, the big thing to know about original Medicare is that there's no limit on out-of-pocket costs. There is absolutely no limit. But by purchasing supplemental plans, you can cover yourself and protect yourself depending upon how comprehensive a plan you purchase. Now, I see there's something in the chat. I have my hand up, a question about whether I can delay my start if I have my own insurance through December, not through an employer, but through the marketplace as a freelancer still working. If you're in the marketplace, you should be signing up for Medicare at age 65.
Yes, I am turning 65 in November, but my coverage is less expensive than Medicare will be because I'm on the essential plan, so I don't have a premium. So I would like to keep my at least Part B through the last month of December. I understand that I have to start Medicare my birthday month, right? That I turn.
Well, it is advisable to start Medicare during your birthday month because you don't want any breaks in coverage.
And I have coverage through December of this year. So the question is, how do I sign up? Am I able to sign up so that everything starts in January?
And you would contact the Social Security Administration and try to get a phone appointment with them.
I got you. Okay.
Yeah. Okay. So what are the out-of-pocket costs with original Medicare? Well, let's start with Part B. This year, there's an annual deductible of $226. We expect it to go up next year. We don't know how much. It could be $10, could be $15, but we just don't know the numbers yet. The current monthly premium is $164.90 for most people. Again, we expect that to go up at least $10 or $15. We don't know the exact numbers yet, but we do know that it will go up because Medicare is starting to cover this new drug that intervenes in early onset Alzheimer's, known as Leqembi. And that's a Part B drug because it's administered in the doctor's office through infusion. And with the anticipation that a number of Medicare beneficiaries are going to need that drug, which is very expensive, that gets put into the premium bill for what everybody is going to pay for the following year. Now, there's about 6 or 7% of the population of Medicare that are subject to the IRMAA, the IRMAA. This is known as the income-related monthly adjustment amount, and people with higher incomes will pay a higher amount for their Part B premium. And this is a chart. It's a very busy chart. I can make a copy of these slides available to Erin, so you don't have to worry about taking too many screenshots or furiously taking notes. But basically, what this chart shows is this. Most people will pay the standard premium this year of $164.90. How is that calculated? The Social Security Administration works with the IRS to get your adjusted gross income from your tax return of 2 years ago. Your adjusted gross income is then has the any tax-free interest and dividends that you were allowed to deduct added back in, and they come up with another number, which is known as your modified adjusted gross income, or MAGI. So if your MAGI in 2021 as a single filer was $97,000 or less, or as a joint filer was $194,000 or less, you'll be paying the standard premium for Part B in 2023, which is $164.90. If you go down the chart, you'll see as your modified adjusted gross income goes up, so too does your monthly Part B premium. In fact, it can go as high as $560.50 a month for people who, as individuals, are fortunate enough to have a modified adjusted gross income of $500,000 or more, or for married couples who have a modified adjusted gross income of greater than $750,000. You'll also see on the right side of this chart that there is a set of surcharges for Part D prescription drug plans for those people who have a Part D plan. Now, a little later on in the presentation, we're going to talk about Part D and creditable drug coverage from retiree plans, retiree benefits, etc. Only the specific Part D classified plans are subject to this additional surcharge. So that's the income-related monthly adjustment amount. Now, Part B has a deductible, $226 this year, and you have to meet that deductible first before your Part B coinsurance starts to work. So how does Part B coinsurance work? Typically, Medicare pays 80% for the charge for the doctor's service, outpatient, and you pay 20% for most services. And I'll explain why it's for most services in a moment. The good news is that laboratory tests and most preventive services are neither subject to the deductible or to coinsurance, meaning that there is no cost and no charge to you. They're covered. And the only time that preventive services, for example, wouldn't be covered is if you try to get a preventive service on a time frame that is more frequent than the Medicare set time frame for something. So if Medicare says you're entitled to a certain test or screening every 2 years, unless there is a medically necessary reason that the doctor can justify for you getting that sooner, Medicare will cover it so long as you stay with that 2-year time frame. Now, here is another thing that you need to know about the universe of Medicare providers. About 97% or so of Medicare providers are known as participating providers who accept assignment. Their terms are synonymous. What does it mean? It means that they have agreed to sign a participation agreement with Medicare. They will accept Medicare's reimbursement as payment in full. You're responsible for the other 20% after you meet your deductible, and they will file the claim for you with Medicare, and then it will get sent on to any supplemental insurance you provide. So it's basically seamless. But there are about 2 to 3% of providers who are also in the Medicare program that are known as non-participating. They can either choose to accept assignment or not, and if they don't, they can charge a little bit more. They're limited federally to an additional 15%, and New York State has a further limit for everything but home and office visits of 5%. What you need to know about non-participating providers is they may ask you to pay them up front, and then you need to get reimbursed by Medicare. How do you know whether or not your doctor is participating or non-participating? You can ask the doctor's office. You can go to 1-800-Medicare and ask them to look the doctor up, or you can go to the official Medicare website, which is www.medicare.gov, and they will tell you which doctors are either accept assignment or don't accept assignment. And that means they're either participating or non-participating. Now, over on the right, in a box with red font, says opt out. Opt out means that a doctor is not in the Medicare program. They've chosen to leave the Medicare program. They are not allowed to bill Medicare for 2 years, and Medicare won't pay for services if you use one of these doctors, and neither will your supplemental plan pay. Opted out providers are about 1% of the Medicare providers nationally, and you'll see a greater amount and percentage of opted out providers in a high cost area like New York City. And typically, you'll see the greatest amount of opted out providers in the mental health field, psychiatrists, psychologists, social workers, etc., have a higher percentage of opted out providers in high cost areas like New York and in other cities around the country than in the rest of the country. So the three types of providers in the Medicare universe that you need to be aware of: participating providers, always accept assignment, file the claims for you; non-participating providers who could do either, and if they are non-participating, they can charge you a little bit more, but they are limited federally and by the state; and then opted out providers who don't accept assignment at all. Let me just pause and ask if there are any questions so far. Okay, not hearing any. This form, the advanced beneficiary notice, oops, getting a little too happy on the trigger here. This form, the advanced beneficiary notice, only applies to original Medicare. You typically go to a doctor with original Medicare and a supplement. They have your insurance information, your care is covered, you get your Medicare summary notice, tells you what Medicare paid, then you get your explanation of benefits from your secondary insurance, and it tells you what they paid and whether or not you owe anything. There are certain situations where a doctor believes that Medicare may not pay for a service. And what they will do in those situations is they will give you an advanced beneficiary notice form and ask you to read it and sign it. And they'll fill in what the service that they want to provide is, the reason why Medicare may not pay, and what the estimated cost of the service is. You get a choice to decide whether or not you want to sign, and in which case you're agreeing to accept responsibility for paying if Medicare doesn't, or you can choose not to sign, in which case the doctor will likely not go ahead and treat you because the form is designed to protect both you and the doctor. The doctor obviously wants to get reimbursed for a service they provide, and you might not necessarily want to pay for something that Medicare doesn't cover. Now, when you go to a doctor's office, you typically get a sheaf of papers on a clipboard to sign and fill out. And they'll typically ask you to update your medical history, your pharmaceutical history. There'll be a form for the office's HIPAA policy. There'll be a form typically for the COVID policy. And then there'll be a form that says, I agree to pay if insurance doesn't. That doesn't apply if you're on original Medicare. If you're on original Medicare, the only financial liability you have is this ABN form. Now, if you sign the ABN form and you agree to accept the service and Medicare doesn't pay, you do still have appeal rights. But ultimately, if you sign the form and Medicare on appeal turns you down, then you are liable, and this is the only time you're liable for a charge. So many people typically go through many years of medical care under Medicare without ever seeing this form. So when would you get it? Well, you might get it if a doctor wants a series of blood work and maybe one or two of the tests is something that Medicare typically doesn't cover. So the lab might inform you that, look, the doctor wants 20 different blood values, 18 of them are covered. These two may or may not be. Medicare in the past has not covered these. So we're going to give you an ABN form to sign. Another common area where we see the ABN notice given out is by chiropractors. Medicare covers chiropractic care for lower back pain via spinal manipulation. Typically, these visits, like physical therapy, can involve 20, 25, 30 or more visits. Chiropractors know from experience that maybe after 20 or 25 visits, sometimes Medicare says, you know what, this isn't working, we're not going to continue to pay. So after a certain number of visits, they might hand you this form, putting you on alert that if you want to go through with therapy, continue with therapy, they're happy to do so, but there's a chance that Medicare may not pay. So that's the advanced beneficiary notice form. Does anybody have any questions about this? We'll get to the chat questions a little later on. Now, this is one of the most important slides about original Medicare's out-of-pocket costs because it shows you what you could potentially be liable for if you're hospitalized. So as soon as you get admitted to a hospital, you have to pay a deductible, which is $1,600. Typically, your supplemental insurance covers this in full. If you have to stay beyond 60 days, you have a co-insurance or a copay of $400 a day for the next 30 days, and then at $800 a day for days 91 through 150. If you land in a skilled nursing facility after a hospital admission, first 20 days are covered, but the next 80 days, if they're still medically necessary, cost $200. And all this is based on what's known as a benefit period. And very briefly, a benefit period starts the day you're in a hospital and ends 60 days if you were discharged. And here's why this is important. Let's say, for example, you went into the hospital on May 1st for 5 days of inpatient care. You have to pay the deductible of $1,600, and that gives you 60 days of coverage. Now, on May 6th, you're discharged. So you spent 5 days in the hospital. You used up 5 of 60 inpatient days. On June 1st, you have to go back into the hospital. Doesn't even have to be the same hospital, doesn't even have to be for the same medical condition. The key point is that you're still in the same benefit period because 60 days has not elapsed since your original discharge on May 6th. So you're still covered by the $1,600 deductible. But now 3 or 4 months go by and it's October or November 1st and you have to go into the hospital again. Well, now you're no longer in the same benefit period because more than 60 days has elapsed.
The Advantage plans.
You're in a new benefit period. Please, everybody, please mute your phones.
Yes, I can.
Thank
Okay,
you.
that's good. Let me see.
So this is the reason why out-of-pocket costs with original Medicare, especially with hospitalizations, can bankrupt people if they don't have some form of supplemental coverage, either a privately purchased Medigap plan or a supplemental plan that they get through retiree insurance, or perhaps they're on Medicaid, or they're covered by the Medicare Savings Program, which we'll cover a little later on. So now let's talk about Medicare supplemental plans because we need a way to pick up all of these out-of-pocket costs. So again, your Medicare choices, original Medicare, Part A, Part B, and prescription drug coverage, or a Medicare Advantage plan, which kind of gives you the same things, but puts an umbrella over it and puts it all into one package. Now we're going to add a supplemental plan and talk about how they work to help cover your out-of-pocket cost exposure with original Medicare. So these are policies that are sold by insurance companies. And they pick up these out-of-pocket costs and they only work with—
Sorry, can you just do that previous screen one second more?
Okay. Okay. Is there a specific question about this screen? Hello? Okay, maybe you
That's fine.
maybe you just wanted to take a screenshot. So Medigap policies pay for your out-of-pocket costs. They pay for the 20% coinsurance, sometimes partially, mostly all in full. They only work with original Medicare. They're sold by private companies. And there are 10 plans that have the following letters. And the most important thing about this is that regardless of which insurance company sells the plan, if you buy a Plan F from company X, it's the same as a Plan F from company Z, only the price will change. And this is where you can save a lot of money with Medicare by comparison shopping every year your Medigap supplemental plan, and high cap counselors can help you with this. Now, these plans all charge a monthly premium for the coverage. And what's different about original Medicare when compared to Medicare Advantage is with original Medicare, you'll be paying this premium whether you use healthcare or not. It's like automobile insurance or homeowners insurance. Whether you need it or not, you're paying for the coverage. When we talk about Medicare Advantage plans, you'll see that with Medicare Advantage, It's more of a pay-as-you-go system. If you don't use the plan, you don't pay anything. If you use the plan, you pay a copay per visit. So what are the basic benefits of the Medigap plans? Well, they cover the Part A hospital coinsurance, all of those costs that we showed you, depending upon how many days you're in the hospital. They also give you an additional 365 days of additional coverage. And that's important because your Part A benefits, inpatient hospitalization, they can be exhausted if you go in and out of the hospital several times during a given benefit period. The Medigap plans cover your Part B coinsurance, either covering part or all of the 20% that you're responsible for. They cover the cost of blood, and they cover hospice care. So these plans are very comprehensive in nature, and when you have some of the more comprehensive supplemental plans like F and G and N, for example, the great majority, if not all of your out-of-pocket costs, with the exception perhaps of the Part B deductible, are covered. So it gives you financial protection knowing that by paying a certain amount for a monthly premium, you're essentially putting something of a cap on your potential out-of-pocket medical expenses for the year for everything that's covered by Medicare. Now, very important about New York State, because it's only one of 4 states that offer this. In New York State, there is a continuous open enrollment for supplemental plans. What that means is that you can change or switch your plan at any time during the year. You cannot be denied for your age. You cannot be denied for your healthcare condition. You can be subject to a waiting period that can be as long as 6 months for a pre-existing medical condition. But if you have other creditable health insurance, like a Medicare Advantage plan, a plan from your employer, a plan from the marketplace, a different supplemental type of plan, or military, VA, or TRICARE, that gets credited and it eliminates the waiting period. And all of the information about Medigap supplemental plans are available at the New York State website for the Department of Financial Services. And if you simply put in www.D for David, F for Frank, S for Sam.ny.gov, it will take you to the Department of Financial Services website. And if you go to the search bar and type in Medigap supplemental plans, you'll get all the information that I am showing you in New York about Medigap supplemental plans. As we go a little further into this discussion, I just want to mention that there is one change to who is eligible for what. And people who became eligible for Medicare after January 1st of 2020 or January 21st, 2020 and beyond are no longer allowed to buy Medigap Plan C or F. Those are the 2 plans that also cover the Part B deductible. But alternatively, they can buy Plan G, which covers everything that F does, but just does not cover the Part B deductible. Now, this is a chart, and again, I can share the slides with Erin so that you can get a copy of the slides. And this chart is also available on the DFS website that I showed you in the previous slide. This shows all of the different benefits that you can get by purchasing a Medigap supplemental plan. The most popular plans are F, G, and N. Okay, G is the most comprehensive plan for those who can't buy Plan F. You see the only difference between F and G is that F also covers the $226 deductible. But you'll often find that the premium for Part F for the year is more than $226 than the premium for Part G. So Part G in many cases is actually the better buy, because even if you have to pay the $226, you're still ahead premium-wise. The other very popular plan is Plan N. Plan N has some cost sharing, so when you go to the doctor, you may have to pay up to a $20 copay for your outpatient visits. And if you go to what is known as a non-participating provider that we discussed earlier, you could be subject to what is known as the Part B excess charges. That's the additional 5 or 15%. F and G cover that, N doesn't. But in exchange for buying Plan N, you'll typically save $70 or $80 or more a month in premium. So it all depends upon what your healthcare is and what your financial status is in terms of how comprehensive coverage that you want. There's also high deductible plans for F and G, where you have to pay the first $2,700 in out-of-pocket Part A and Part B costs. But in exchange for that, your monthly premium is about $200 a month less. So if you're relatively healthy and you want the protection of super comprehensive insurance in the event that something bad happens unexpected during the year, a high deductible plan may be a good bet for you. And again, high cap counselors can discuss this in much greater detail in a one-on-one situation with you. I'm going to show you a chart that comes from the website based from last January that shows the different prices for the different Medigap supplemental plans. And I've highlighted some things in red, not to focus on the individual companies, but to make comparisons for you. Here you'll see that Plan G can be purchased for $281 as of January 2023. These rates change during the year. The most up-to-date rates are available on the website. You could pay $281 a month from Transamerica and as much as $705.38 a month from Bankers Conseco and everything else in the middle with the other companies. It's the same Plan G, regardless of who you buy it from. Same thing with Plan N. You could pay as little as $217.25 a month from United Health AARP, or as much as almost $440 a month through Bankers Conseco. So spending a little bit of time to shop for a Medigap supplemental plan or working with a high cap counselor can help you save a lot of money. Got some tips for you. We discussed the difference between F and G, in that F pays the deductible and G doesn't, but you need to see what the overall annual premium is for both to determine which is the better buy. We talked about saving money on the monthly premium with Plan N, but you will have to pay up to $20 per office visit after you meet your deductible. Talked about the high deductible plans that might be suitable for some. There were other plans like K&L where you have to cost share not only for Part B visits, but for hospitalization visits as well. And in exchange for purchasing a Plan K and Plan L, you get some maximum out-of-pocket limits. And the key thing to remember is that all Medigap plans of the same letter have the exact same benefits, no matter which insurance company sells them. So let me pause now and ask if there are questions about Medigap supplemental plans. Now, I would bet that most people have seen an ad like this, right? Joe Namath, or maybe it's George Foreman, or maybe it's Jimmy Walker, the comedian, or maybe it's even William Shatner now that he's truly back from space, right? So these are celebrities that are pitching supplemental plans, pitching Medicare Advantage plans, not original Medicare. So when you see these ads, it's very easy to get confused because the way some of these ads are worded, it makes you think that you're missing out on all kinds of benefits. And you need to call an 800 number and give them your zip code to see if you qualify. Well, what they're talking about here are Medicare Advantage plans. And these ads will link you to insurance agents at the other end of the 800 number to sell you a Medicare Advantage plan. The important thing that you need to know is if any of you have retiree health care benefits, please do not sign up for any Medicare plan unless you speak to your retiree health benefits people. Because in many cases, if you sign up for one of these plans, or you sign up for a drug plan, we'll get into this a little later on, you can wipe out your retiree benefits and not get them back. And I can't repeat how important that is often enough. Don't get lured in by these TV ads. If you have any kind of retiree insurance, please first consult your former employer's health benefits people. Now, continuing with this theme, you'll hear things about routine dental care and routine eyeglasses and hearing aids and long-term care and physicals and services outside the United States and gym memberships and things like we'll take you to and from the doctor even if it's not an emergency, and we'll deliver hot meals to your home after a hospitalization or a nursing home stay, and we'll give you these debit cards where you can go grocery shopping or you can go over-the-counter shopping in the pharmacy. None of these services are covered by original Medicare. These services are covered by some Medicare Advantage plans, albeit with limitations and restrictions, so you have to read the fine print. Are there any questions about these non-covered services under Original Medicare? Okay. Again, let's review. Original Medicare. It's like ordering a la carte in a restaurant, right? Everything is separate. Part A, Part B, supplemental insurance, and prescription drug coverage. Medicare Advantage plan, it's kind of like ordering off of the specials menu where everything is included for one price. Part C, which is the designation for Medicare Advantage, combines A, B, and usually Part D. So now we're going to talk about Medicare Advantage plans. So in order to be in a Medicare Advantage plan, you have to have both Medicare Parts A and Part B, and you have to live in the plan service area, which is where the plan has a contracted network of doctors. Enrollment in Medicare Advantage. Well, everybody can enroll in Medicare Advantage or Original Medicare or change their Advantage plan or change their drug plan in the upcoming annual open enrollment period, which starts very soon, October 15th, and runs till December 7th. And there is also a special Medicare Advantage open enrollment period each year that runs from January 1st to March 31st every year, during which you can change your Medicare Advantage plan or you can go back to Original Medicare. So what are the benefits and costs of Medicare Advantage? Well, they cover at least what Medicare covers. They have to do that by law, and they're allowed to provide some additional benefits. And in exchange for that, you pay a fixed co-payment or co-insurance for most services. So, for example, if you go to the physical therapy or et cetera, physical therapy or to a specialist or to your doctor, there's typically a copay. You have to go into the hospital, there's a much higher copay. Sometimes with Medicare Advantage plans, the copays can be as high for hospitalization of several $100s a day, each for the first several days. So your healthcare history is an important determinant in figuring out whether or not a Medicare Advantage plan is right for you. And in New York City, you have an abundance of choices because there are about 50 or more Medicare Advantage plans. And often people say, well, how do you whittle down from 50? How do you make a decision? Well, the easiest way to make a decision if you're interested in Medicare Advantage is to call each doctor's office and see which plans they take. And then you'll typically come up with a list of 6 or 7 plans out of the 50. You would then ask those plans which facilities are covered by their plan. So, for example, if people want joint replacement surgery, many want to go to the hospital for special surgery. If people need oncology care, they often want to go to Memorial Sloan Kettering. Whether or not those facilities are in a plan's network is important for many people because if they're not in the network, the cost to use those facilities can be exceptionally high. And once you narrow the number of plans down that might work for you with the doctors that you're currently using and want to continue to use, then you could either speak to a HICAP counselor or you can go to the Medicare website at www.medicare.gov or call 1-800-MEDICARE for further assistance in choosing a plan. So what are the basic types of Medicare Advantage plans? Well, there are a number of types, but typically we're dealing with 2 different ones. One is the Health Maintenance Organization, or the HMO. And these are the most restrictive of the Medicare Advantage plans because they provide in-network benefits only unless it's for a bona fide emergency. That means that you have to see a doctor that's in the network in order to be reimbursed for your care. And even more than that, the health maintenance organizations tend to have much smaller service areas. So, for example, they might operate only in the Bronx or only in the 5 boroughs of the city, or only in the greater New York City metropolitan area. So if you travel a lot and you're a snowbird, an HMO is really not for you because you won't be able to get any routine care outside of the service area of your plan. The HMOs are also the Medicare Advantage plans that typically don't charge any additional premiums. So if you're relatively healthy, if you're happy with the doctors in the network, you only make a few visits a year, you're looking for some of the extra benefit coverage like dental or vision and hearing, an HMO plan might work very well for you. There's a limited number of HMO plans that have some out-of-network coverage. They're known as HMO point of service plans, but you must read the fine print because the coverage tends to be very limited and very restricted. Now, the other form of Medicare Advantage plan that's very popular with people is the PPO, or the Preferred Provider Organization. PPOs allow you to go outside the network to any doctor who will accept Medicare. The give back is that you will likely pay a much higher copay, and you may have to pay that doctor up front and get reimbursed by your plan. But using the snowbird example, if you go to Florida or Arizona or someplace south outside of New York State, you're in a PPO. Typically, PPOs have networks of doctors throughout the country, especially the bigger plans, and you'll be able to get your coverage for routine care. If you're lucky to get it in network, you'll pay less. But if you need the care and it's outside of the network, you can still use the doctors and be reimbursed so long as the care is medically necessary, but you'll pay a higher price. So those are the difference between HMOs and PPOs. And PPOs tend to be the Medicare Advantage plans that may have their own separate premium. And remember that everybody has to pay that Medicare monthly Part B premium, typically the $164.90, regardless of whether or not they get original Medicare or they have a Medicare Advantage plan. Now, here's the big thing that you need to know about Medicare Advantage plans, because the financial implications of this are very significant and can be very significant. Medicare Advantage plans have an annual maximum out-of-pocket dollar limit. Okay, so what you pay doesn't include the premium, it doesn't include your drug costs or any of the added benefits like dental, vision, or hearing. But anything that you pay that involves cost sharing for your inpatient or outpatient care under Part A and Part B counts towards this maximum out-of-pocket limit. So that's the good news. But now here's the other side of the coin. The limit is pretty high. It's $8,300 a year if you stay with in-network doctors only, and $12,450 a year if you use both in and out of network doctors. Now, why is this important? Well, remember when we were talking about original Medicare and paying for a supplemental plan, and I showed you some illustrations where some of the most comprehensive plans like Plan G, you could pay about $280 or $300 a month. Well, that's $3,600 a year for just about everything being covered with the exception of the $226 deductible. That $3,600 a year, even if you're paying for a separate drug plan, is about half what you could potentially be liable for if you use so much healthcare, including hospitalizations, with an Advantage plan where your maximum out-of-pocket could hit $8,300 or $12,450. So that's why when you're choosing which way to get Medicare, your medical history and your anticipated, if to the extent, I mean, some people know that because of underlying conditions, it's likely they may be in and out of a hospital a couple of times during the year. Knowing your medical history as well as your financial ability helps make this decision. And if you need help with this kind of a decision, again, high cap counselors can help you. They can't tell you specifically which plan to buy because they're not insurance agents. They're not compensated. Everything is free of charge, but they can educate you to the point where you can make a smart choice. And again, remember that with Medicare Advantage plans, you're not allowed to be sold or have a supplemental plan. They do not work with Advantage plans. So are there any questions now about Medicare Advantage plans? There's a hand up. Valerie?
Hiya. Yeah, question. Is this all essentially, if I move, I'm a New York resident, have been a long time. If I, let's say, move to New Jersey in 5 years, a year, whatever, is that going to have a significant effect on Advantage or not? And, how does all that work? Because it's state.
New Jersey has its own Medicare Advantage plans. You have to find a plan that operates in the specific county, the 23 different counties, the county that you live in. And New Jersey has other rules like the other 46 or so states do with regards to supplemental plans. And why is that important? Because if you live in a state that isn't like New York, that has guaranteed enrollment in supplemental plans, and you switch to Medicare Advantage, and let's say you're 75 or 80, your healthcare condition worsens, and now you want to go back to original Medicare with a supplement because you don't want somebody telling you which doctor to go to. And if you want to go to a certain hospital, you don't want to hear that it's not in the network. You might not be able to get a supplemental plan in these other states because they medically underwrite. They don't do that in New York, but they do in some other states. So If anybody's considering moving to a different state, you need to get in touch with the state health insurance program, which is known as the SHIP, SHIP, similar to HICAP for New York City, and find out what the rules are in that state before you make any changes to your health care, before you make any choices about different plans, before you talk to an insurance broker, if you're going to use one, etc.
Can you please repeat that SHIP, the website or the number?
You would Google, you'd go online and Google State Health Insurance Assistance Program, State Health Insurance Assistance Program, and you'll get an 800 number that will direct you to the specific SHIP that services wherever you live in the United States. Okay, so we're up against an hour now, and I have a few more things to cover with everybody. So we're going to talk about Part D prescription drug coverage. With original Medicare, unless you have private coverage, you need to purchase a standalone prescription drug plan known as Part D. With Medicare Advantage, your Part D is typically included within the package. Now, each drug plan has its own formulary, which is the list of the drugs they cover. They must offer at least 2 drugs under each type of drug class, and they must cover substantially all the drugs from a few of the different classes. We're not going to go into the details here, and a few classes of drugs are excluded by Medicare coverage by law. Each plan charges different premiums, deductibles, and copays, and the average premium for a standalone drug plan is about $34 next year, $34 a month. Now, these plans use tiers to characterize the different drugs. The tiers set the price levels, and you can see a sample tiering structure here on the slide. Now, there are also different costs during different phases of the year when you're getting your Part D drugs. Initially, you typically have to meet a deductible. Then there's a period where you'll pay a specific copay. Then there's a period known as the coverage gap where you'll pay 25% for your drugs. The plan will pay the other 75%. And then after you spend a certain amount of money out of pocket, you go into what is known as catastrophic coverage, where the plan will cover 100% of the costs. Now, Part D prescription drug coverage is not mandatory. It's optional and it's voluntary. But if you don't have Part D prescription drug coverage or some other creditable plan from an employer, there's a penalty assessed of 1% per month of the average national premium, and that gets added on to the premium when you pay for a Part D plan. There are 19 standalone Part D plans in New York City and New York State in 2023. That number is going to drop to about 15 or 16 in 2024. They all have their own formularies and pharmacy networks. And again, there are these enrollment periods, the open enrollment coming up now from October 15th to December 7th, where you should shop and look at what drug plan is best for you. And you can do that at the website, www.medicare.gov. You can do it by calling 1-800-MEDICARE, or you can do it by working with a HICAP counselor. This year, the deductible is $505. The phase where you will pay the copay runs up to spending $4,660 in total drug costs. And then once you go over $7,400, you're in catastrophic coverage. All of this information is available at the official Medicare website. Now, some reminders. There's no cost sharing and no deductibles for all Part D vaccines, including now the shingles vaccine. And your insulin copays are limited to $35 each month for Part D and Part B covered products with no deductible. Now, some people have retiree coverage that's known as creditable. It means their plan is equal to or better than the Medicare Part D plan. And so these plans work in place of Part D. And if you have one of these plans, you will not be subject to a penalty for not enrolling in Part D. And now, everybody who has a retiree plan that has drug coverage is supposed to get a letter or some type of notification in the fall of each year saying that for the following year, your plan is considered to be as good as or better than the Medicare plan. And you should save that letter, because if Medicare ever challenges you in the future for not being in a Part D plan and wants to assess a penalty, that letter or notification that sometimes comes in a newsletter or in a booklet of benefits shows that you had creditable drug coverage that takes the place of Part D. Now, I want to talk briefly about some programs that can help you with your out-of-pocket costs. The first is called Extra Help. It's known as the low-income subsidy. If you fit into any of these income limits for either singles, which is the first number, or couples, which is the number in the parentheses, and the asset limits, contact the high cap counselor because you may be eligible for significant help with your out-of-pocket drug costs. We do not have the time to go into detail about this in this presentation, but take a look at these numbers, write them down, and if you feel you may be eligible, contact the high cap counselor if you're not already getting the benefit. Many of you should be familiar with the Elderly Pharmacy Insurance Coverage Program, which is a program run by New York State to help with out-of-pocket costs with prescription drugs. It's known as EPIC. And the good news with EPIC is that many more people qualify because the income limits are much higher and there's no asset limit. So you can earn up to $75,000 as a single individual, up to $100,000 as a joint filer. And with EPIC, there's a fee or a deductible plan. People at the low end of the income scale pay a fee, and then they're automatically eligible for EPIC benefits. People who earn more than about $25,000 up to the $100,000 are in the deductible plan. They first have to meet the EPIC deductible for EPIC to work. But this is what EPIC does. It caps your copays at a maximum of $20. And even more importantly, it gives you an additional time during the year to change your Part D drug plan. And one of the reasons why that is so important is because sometimes we have a sudden change in health and we have to take new and expensive medications. And there are drug plans out there that will give us a better price at the pharmacy counter for the drugs, but we can't enroll in them until the annual enrollment period at the end of the year. If you have EPIC, you get a one-time special chance during the year to change your drug plan. You can get EPIC information at this 800 number. You can Google EPIC online, and most pharmacies have the EPIC brochures if you're not familiar with EPIC. Medicare Savings Program is a very important program that had a significant rise in the income level, and there is no asset limit here, significant rise in the income level for 2023. Take a look at the numbers here. Focus on the bottom line for the qualified individual program, $2,107 monthly income for individuals, $2,839 for couples. It's an estimated number, but the number is very close. If you qualify for the Medicare Savings Program, you're going to get significant help with just about all of your prescription drug costs, including the premium. It's going to pay your Part B monthly premium for you. And if you qualify income-wise at this level, $1,536 for individuals a month, $2,106 per couple, it'll also cover your Part B premium, your deductible and co-insurance, and your Part D drug costs. It functions like a supplemental plan for Medicare that you don't have to pay for. Again, if you feel you meet these income requirements, and there are also ways to get your income down by taking certain deductions against your income, high cap counselors can help you, and they can help you save significant money. The people who qualify for the Medicare Savings Programs can save several hundred, if not several $1,000s a year in healthcare costs. Again, don't be bashful. Call a high cap counselor. The phone number is 212-AGING, New York City. Very quickly to repeat, annual open enrollment, October 15th to December 7th. You can change your Advantage plan. You can change your Part D plan. You can decide to go from original Medicare to Medicare Advantage or go in the other direction. Go from Medicare Advantage back to original Medicare. What are the questions you need to ask? Can you continue to use the same doctors if you're interested in a Medicare Advantage plan? Are your doctors in the plan's network? Do you need a referral to go to a specialist? With original Medicare, remember, you can see any doctor that accepts Medicare without a referral. With Medicare Advantage plans, there are networks of doctors, and you may need a referral to see a specialist. Do you want a plan that covers services that original Medicare doesn't? Well, if you do, you may want to look at a Medicare Advantage plan. You need to be aware of the rules and restrictions when accessing those benefits. Remember that original Medicare doesn't include these things you see advertised on television, like hearing and vision or dental coverage. Medicare Advantage plans may, but make sure you're aware of the limitations and restrictions. Medicare Advantage plans and supplemental benefits. Remember that some of the Medicare Advantage plans can also offer benefits that are not directly considered to be medical treatment, which are called supplemental benefits. And some of these can include this transportation benefit for non-medical reasons, non-skilled in-home support like housekeeping, adult health, adult daycare services. The benefits vary between the plans so that you need to research the plans to see what might be best for you. Comparing costs. Remember, with original Medicare, there's no limit on your out-of-pocket costs. That's why many people purchase a Medigap plan. With Medicare Advantage, there is a limit, but it can be very high, as we showed you earlier. And remember that you cannot have a Medigap plan with Medicare Advantage. And again, if there are any questions, here's the high cap number. Again, you can remember it easily by using 212-AGING, A-G-I-N-G, NYC. Now that concludes the presentation, and we'll have a little bit of time for questions. So Erin, I don't know how you want to handle the questions, but let me know what you want to do.